I am Lucy Smith, and I am the Special Projects Coordinator for Syntero. To those of you that are new this week, welcome. We're happy that you're here. And to those of you that have returned from last week, welcome back. We appreciate you. Just a little bit of background that Syntero has been providing outpatient mental health and behavioral health services in the community for more than 40 years. The services to our older adult population, as well as their families and caregivers, has been a really important part of that service history. We have a dedicated team of older adult professionals who are licensed, and they provide mental health, outreach, education, consultation, and supportive services to the older adult population. As you know, we decided to embark on this series called Caregiver Connection so that we might address specifically the very difficult needs that caregivers are facing, and especially because of the isolation and stress that we have experienced because of the pandemic. We know people are living longer. We know people are being called upon to care for each other, a family member, a friend, a neighbor. We know that providing that care is not always simple. It can be very complex. And so what we were hoping to do through this series was to provide information that would help all of us feel better about moving forward in our role as a caregiver. I have a quote: caregiving often calls us to lean into a love that we did not know was possible. In addition to that love, we know it takes knowledge, we know it takes education, we know it takes support, and we know it takes connection. This week, we are going to focus on care for the caregiver, which is all of you who are attending. We may all know the importance of self-care, but to practice that care and to find the time to give ourselves that care is not always easy. Today, we are looking forward and hoping to renew and refresh ideas for you that are proven to help those of us in a caregiving role ensure that we are at our very best, physically, mentally, and emotionally, to provide the very best possible care for those people in our world. Remember a couple of things for housekeeping before I introduce the most important man of the hour. We are recording this session. If for any reason you prefer not to have your image displayed or recorded, please feel free to go ahead and disable the video function on your computer. Also, we want you to know that we welcome your questions. We're sure that you will have many, but we ask that people utilize the chat function so that we can go through the presentation in an uninterrupted manner and address those questions at an appropriate time. Without further ado, I welcome you all again, and I'd like to introduce to you our longtime Syntero caregiver consultant with over 20 plus years of experience in the role, Mr. Dan Brochetti, LISW. You're on, buddy. Well, go ahead and welcome them.
Okay. Hello, everyone. My name is Dan Brochetti, and I'm a social worker counselor here at Syntero, and I work in the Caregiver Consultation program. It's a program that's designed to help and support caregivers of older adults. So, for example, many of my clients are adult children caring for a parent or parents. A lot of them are spouses caring for their husband or wife. Other examples include grandchildren caring for grandparents, nieces, nephews caring for aunts and uncles. So those are many of my clients. Some of them are long distance caregivers. They live in other parts of Ohio and even throughout the United States. And the person that they're concerned about or caring for lives in Franklin County, Ohio. So I even have long distance caregivers. My role is to provide my clients with information about caregiver support resources. Examples include home health care services and home delivered meals. And then I have a supportive counseling education part of my job, which is to help caregivers learn ways to take good care of themselves. We call it care for caregivers. So that's what I'm going to focus on this afternoon. Different strategies, suggestions, ideas on what, if you're a caregiver or know somebody who's a caregiver, what you can do to take good care of yourself while you're caring for a family member. So and my coworker Beth is helping me get set up with the slide presentation. And of course, as a caregiver, you're not alone. There are many, many other caregivers throughout the country. Some are recent caregivers. Some have been caregivers for months and years. So there's a range of times that caregivers can be caregivers. I always begin, when I talk about care for caregivers or strategies to reduce caregiver stress, I always focus on what's called the Caregivers Bill of Rights. And the first and most important of that Bill of Rights is that you have the right to take good care of yourself. You're not being selfish, uncaring, or irresponsible in any way if you set aside more time for your needs. And that's both basic needs and quality of life needs. And here it is. Yeah, I have the right to take care of myself. And you're not being selfish. And by taking good care of yourself, you'll be a better, stronger caregiver for the person you're caring for. Go through some more other bills of rights here for you. You have the right to sometimes to get frustrated, worn out, depressed. If you're a caregiver, you have the right to receive consideration for your hard work. And you have the right to take pride in what you've accomplished. Caregivers work very hard. They work rapidly. The pace can be very fast. And so take pride in what you accomplished. Maybe you didn't get everything done you wanted to do on a given day. So I always tell my clients, well, take a break, slow down, stop. Don't do any more. If it's possible, don't do any more that day and wait to the next day or in 2 days and pick up where you left off. So you want to pace yourself over the long run. And here's some additional rights on the Caregivers Bill of Rights. So take good care of yourself, set aside time for your needs, give yourself permission to do that. What stops a lot of caregivers from sometimes setting aside time for needs is guilt. And I've had caregivers that I've worked with in the past who told me what helped them was that they set a limit to the guilt. 10, 15 minutes at the most. And they said, okay, I need to move on and do something good for myself today. It might be, catching up on some chore or errand that you've been putting delaying, or some quality of life activity like exercise and getting together with friends. So set a limit to the guilt, and then make a plan to do something that you need to do, that you need to do to take good care of yourself. And when we take good care of ourselves, that's physical health, emotional, spiritual, intellectual, can be vocational, educational, and nutritional. Our diet and nutrition is very important. Social interaction with others. So you want to do a comprehensive, holistic approach, taking good care of yourself. Try to make sure you're covering all these areas as much as you can throughout the course of the week, and make a plan to do that. Nutrition. I can't tell people what to eat or how much to eat or anything like that. But I always tell my clients, if you feel like you want to improve your diet and nutritional status, I always recommend that they start with talking to their doctor, and then your doctor might recommend that you then talk to a dietitian or nutritionist. They can be very informative, very helpful, very beneficial in helping people learn good diet and nutritional habits. Sleep. You want to make sure you're getting a good night's sleep. And from what I've discovered in my work with clients, caregiver clients, is that if they're exercising throughout the week, they tell me they sleep much better. They get a much better good night's sleep. I exercise every day, and I know it helps me be able to get a good night's sleep. So keep exercise in mind. You got to move. So try to do a variety of exercise activities throughout the week. Other helpful activities include hobbies, crafts, recreational activities. I've had caregiver clients that in the summer months, they get together with friends and family members, and it could be just in your backyard or a nearby park, playing bocce, playing croquet, playing board games. If you can do even more than that, great. But so try to find a variety of activities like that. And laughter. Laughter is very important. Try to do things where you're with other people or anything you can do on your own. It's things that you can do that make you laugh. It could be something that's funny that you read, maybe something on television that you would enjoy watching. So there's a lot of different things to do. It takes some time to explore different options and avenues. A lot of it now is on the computer, but so it's available to you, and take the time to explore that. I always recommend to my clients the Columbus Metro Park system. The Columbus Metro Park system has a lot of parks, a lot of activities going on. Try to find out if there's ranger guided hikes at a park that might be near you. You might enjoy and find it very beneficial to go on a ranger guided hike sometime during the week or on the weekend. And then if you can't get to a Columbus Metro Park, I always encourage my clients to try to get to the closest city or municipal park that's close to their home, maybe one that they can just walk to. So take advantage of even just municipal parks. Get some fresh air. A day like today is a good example of to get some sunlight, get some good fresh air. Get away from your computer, television, phones. Disconnect all the technology and get outside and get some good fresh air. And here's more information about taking advantage of outdoors, flowers, birds. I know when I go to parks, I enjoy watching people play with their dogs. It's fun to watch people interact with their dogs, and watching kids play in a park, or even just watching. I sometimes stop and I'll watch lacrosse games, soccer games, softball games, other recreational sports activities. And it can be just a good way to just relax and watch other people interacting in that way. And so take advantage of it. It's close. And a lot of times there's no cost to it. It's free. Part of taking good care of yourself, care for caregiver strategies to reduce caregiver stress, is taking advantage of caregiver support resources, which can help pay for caregiver support resources like home health care, home delivered meals, an emergency medical response system, transportation to medical appointments. One program that's available in this area, and actually this program is available in all 50 states, it's called the National Family Caregiver Support Program. I'll say that again, the National Family Caregiver Support Program. It's administered locally by the Franklin County Office on Aging, and it has subsidy money or financial assistance that can be used to help pay for caregiver respite services, home health care, durable medical equipment, and a variety of other services. A lot of caregivers want to be able to set aside more time for these, want to have the energy to do that, but they can't do it until they have a program like the National Family Caregiver Support Program in place first. They tell me if they have services coming into the home, like home health care, home delivered meals, that gives them the time and energy to go out and do something they know they need to do for themselves. Basic needs, quality of life needs. So you may have to take advantage of a program like this. And here's some more information about the National Family Caregiver Support Program. Durable medical equipment, helping find out about home health care, caregiver respite services. So these are just some of the, and there's many other than what's listed here. There's some benefits through this program that sometimes they have additional funding, additional money comes in, and they can offer even more benefits. So it can change over the course of the year with additional or new benefits. A lot of my clients, since the shutdown, are exploring different types of websites. And here's an example of some websites that could be of interest to you. OSU related websites, arts, for example, the Dublin Arts Council. Worthington has a very good arts council. So take a look at those. Recreational program, metro parks, senior centers, recreation centers. Explore the different websites. You may find something that's going to be interesting for you, something that's going to be helpful and beneficial for you, educational in nature. So it takes time to explore each one of these websites, but when you do have the time, I would encourage you to maybe start with just one, maybe do 1 or 2 a week, and pace yourself in that manner. And that way you can find out what may be taking place that you would like to take advantage of. Here's some additional local caregiver support resources. I mentioned the Franklin County Office on Aging. There's also the Central Ohio Area Agency on Aging, which covers the 8 counties that make up Central Ohio. The Ohio Department of Health. Some caregivers also utilize the Ohio Department of Insurance to get information, help, and guidance around Medicare and Medicaid questions. The National Institute on Aging has really, really helpful information. And this week, I received 200 copies of this book called Getting Fit for Life. This is from the National Institute on Aging. And so it's exercise and physical activity. I just was reading through it briefly before the start of the presentation. It's a good manual, a good hands-on manual that you might be interested in looking at from time to time. It gives some structure for people to begin and maintain an exercise routine. I know in my work with caregivers, they tell me, yeah, I started exercising 6 months ago, then I stopped and I haven't resumed. And so having some structure in place can a lot of times keep you exercising where you don't stop and have to start all over again. And this manual, along with other manuals, can help you maybe be able to maintain that pace of the routine. You want to, if you get started exercising, you want to try to maintain it on a weekly basis, so you don't have to start all over from the beginning again. Yeah, and with regards to exercise, if you can exercise with a close friend or a neighbor, or other people, as recreation centers, fitness centers, and senior centers begin to reopen, many times that makes it easier and more enjoyable for caregivers to exercise in a weekly routine because they're in a group, they're in a scheduled type session. So as things do begin to reopen, take advantage of them, even if it might be at a reduced capacity. Music is very helpful and beneficial for caregivers. Music, the arts, all the different forms of visual arts, the performing arts. I've had caregivers that I've worked with in the past, and some I'm working with now, who tell me what has helped them lower stress, lower anxiety, help them re-energize, is to be involved in a variety of arts that they enjoy. For example, you might want to look into Audubon University's theater program. I'm a subscriber. I've been going to their plays for the last 25 years. Right now, it's all through Zoom presentation. I'm not sure if the upcoming season is going to be Zoom or in person, but if it's in Zoom, you might still enjoy watching their performances. So explore the different theater programs all around Central Ohio, and music programs could be a music program at your local high school that's near your home. So see if there's any Zoom, because music, the arts of all kinds can be very soothing, very relaxing. So and you may have to explore the different websites to find out what's available and get a schedule. Pet therapy. Pet therapy is very beneficial and helpful for anybody, whether you're a caregiver or not. So look into pet therapy. It doesn't have to be the formal pet therapy that you might find at a clinic type setting. It could be something as simple and funny as I've been doing a lot of YouTube videos since the shutdown, and I found a really funny one on YouTube called puppies barking at themselves in the mirror. So if you just type in puppies barking at themselves in the mirror, you'll see a whole listing of different videos of puppies doing funny things like that. Sometimes it's full-grown dogs, but a lot of it's the puppies seem to be the funniest, and it's a great way to laugh. And there's also other YouTube videos of pets that people have submitted to YouTube or the Animal Planet things that their pets have done in the home or out in the yard that I think you might find very amusing. So it's like a type of pet therapy. Another very relaxing, I think I find this very relaxing and soothing is when I need to if I find myself watching too much television, okay, I need to take a break from the commercials. On my computer, I type in waterfall sounds, the sounds of waterfalls or a river. And there's a lot of different videos to choose from around with waterfalls. I have found some that are 8 to 8.5 hours long. And you just, I don't know, it could be the ocean waves. Some people prefer ocean waves. So nature sounds like that. Other ways to connect with caregivers, taking good care of yourself, is to learn what other caregivers are doing, what has worked for them to reduce stress and lower anxiety and re-energize. So when I talk to my clients, I encourage them to explore caregiver websites, books about caregiving that have been written by caregivers, and caregiver support groups. I also recommend checking our Syntero Cares hashtag, Caregiver Connect, any hashtag related to self-care. Caregiver websites are very, very beneficial. You can go on and see what other caregivers around the country have done or currently are doing to cope better, to reduce stress, to learn about resources. One, for example, that you might want to start with first with a website is called Today's Caregiver or Today's Caregiver magazine. It's the caregiver website that I go to more than any other to learn about care for caregivers. I think that particular website has I think you'll find has very helpful and beneficial strategies and suggestions on ways you could do, things you can do to take good care of yourself. So again, it's called Today's Caregiver. You may also have to type in the word magazine, Today's Caregiver magazine. Oh, and here's some books about caregiving that have been written by caregivers, books that you can get at libraries. You may be able to get some of these books at Barnes and Noble. It can be very helpful to read what another caregiver has experienced. Sometimes the author is an adult child writing about caring for a parent or parents, or author might be a spouse who wrote about caring for their husband or wife. But what I found from the books, the chapters that I've read, the books that I've read, they all have very helpful strategies, ideas, suggestions on what you can do to take good care of yourself. So what worked for a caregiver might work for you. You don't know until you try. So if you have the time and the energy to read, think about some of these books here. And then in my work with my currently right now, I'm doing all phone sessions with my caregiver clients. You can call me anytime, leave a message, and I'll call you back. And I can begin the caregiver consultation process right over the phone, talking to caregivers about the Caregivers Resource Network, the Aging Network, and the Resource Network, as well as care for caregiver strategies. Here's a listing of our office locations. I'm currently at the Dublin office. And this is my contact information. My phone number here, 301-4030. And I tell my clients, call even after 5 o'clock, even call on weekends. If I wait till Monday, I've waited too long. And I'd be happy to take a call at any time and have a conversation with you about being a caregiver. Typically what I do after my phone conversations, some of which last very, very long, I'll do a follow-up mailing because at my house, I have printed material that I mail to caregivers if they like for me to do that. And a lot of it is articles on care for caregivers, strategies to reduce caregiver stress, coping with the emotional impact of aging, loss of independence, as well as printed material on the aging and health network of Central Ohio. So information, if you need information about home delivered meals, home health care services, all types of senior citizen housing, information about Medicare and Medicaid, veterans benefits, I can put that together, a mailing for you and get it out to you in the mail. And so having that printed material, it can be very helpful. It's got contact information, and I'll even put in highlight yellow a program you might want to start. So Our next session will be on May 19th, and we'll be talking about practical ideas and strategies that you can engage in and participate in with the person that you're caring. And at this time, I wanted to see if anybody had any questions about what I said, any feedback. It can be at any time. Just above all, make sure, keep that caregiver bill of rights. You have the right to take care of yourself. You're not being selfish, uncaring, or irresponsible in any way if you set aside more time for your needs. So keep that thought going through your mind. That's what helps a lot of my clients get started and maintain on a schedule of taking good care of themselves. Okay. All right. And I'm going to bring Lucy back for you.
Thank you.
It's sort of like a magic show. Boom, here's Lucy back again. I heard so many important things, and I've listened to Dan many, many times as a colleague and a coworker, finding joy for yourself and what you are doing, finding connection, not being afraid to reach out, and knowing that there's so much help available for all of us serving in the role of a caregiver. We're really happy that you were here for this session. Taking care of you is most important of all. And I found a quote that I wanted to share with you while we were preparing, because I think it's very powerful. It is so important as a caregiver not to become so enmeshed in the role that you lose yourself. It's neither good for you nor your loved one. Again, words that are easy to read and we can use them as a mantra. Trying to implement them is not always so easy. But one of the most exciting things to me about this project that we've embarked upon, my colleagues and myself, is that we are forming this network and we are forming this connection with each other. And we plan to continue it even beyond May 19th in any way possible so that we can help you with whatever things are concerning you that you feel that you would like more information on. We welcome your feedback, and we're excited next week because we think we have another great topic and a lot of good content, and that's our focus will be on ideas for engagement and interaction with your client and your loved one. So we are excited. We are grateful that you were all here with us today. And I will just ask one more time, was there anything that you would like to hear repeated or any information today? It will be recorded. We will mail out some follow-up information for you. But is there anything at this moment that either Dan or myself or Beth could help you with?
I should have asked Dan. Is he saying there's actual support groups through Syntero? Dan, I've been very active in the Alzheimer's Association, and I need some more support than they are able to give right now.
I can provide one-to-one caregiver counseling support for you.
Okay.
And there are caregiver education support groups. Most of the groups are what are called disease or disability specific groups. Examples include Alzheimer's, Parkinson's disease, Huntington's disease, Lou Gehrig's or ALS, head injury, brain injury groups. But even if you're caring for somebody who may not have that condition or diagnosis, you can still participate in those groups, and you might find it beneficial or helpful because a lot of the discussion focuses on care for caregivers, strategies to reduce caregiver stress. So those are the disease disability specific groups. A Zoom format. They meet throughout the year. When they had in-person sessions, they would meet for about an hour to an hour and a half. So those groups can be very helpful. I'll be providing one-to-one caregiver supportive counseling for any caregiver, and that can be on an ongoing basis. but focusing again on care for caregivers, resources, planning for the future. Those are the typical topical subjects that I help my clients with.
Okay. Thank you.
You're welcome.
We do have many support groups that focus on different things, and there have been caregiver support groups right now. As you know, Deborah, everything is sort of at this place where we're just waiting and waiting. So always stay connected through the people you know here and through Dan. And if there's an opportunity for us to begin gathering people together, we definitely would do that because we know that's most helpful.
Yeah, it is.